Hello and a very warm welcome to Bharata. This is Frank Talk. I'm Frank Pereira. Since you're here, I would like to thank you for your continued support. For those of you who haven't already subscribed, please like the video, subscribe, hit the bell icon, and then all notifications. Do follow our social media handles for all the latest updates, and you can also subscribe to our newsletter to get some incisive content. The Bharata First team runs a daily big picture quiz. Please do participate by going through the description in the big picture videos. Here are the UPI IDs for those of you who would like to come forward and contribute. A small contribution you make will be a giant leap for us to keep bringing you this content. So do continue to show your love and support. All the information is in the description of the video, so kindly go through with it. Now, the COVID-19 pandemic has brought to the fore and compounded problems for women and children. We've seen cases of domestic violence go up around the world as a result of the pandemic. To talk about the impact of the pandemic on women and children, I have with me on the program a very special guest. Someone I first met a few years ago on the sets of Rajya Sabha TV, a woman whom I hold in very high regard. It's a pleasure to welcome on the program Ms. Lalitha Kumaramangalam, former Chairperson, National Commission for Women. Thank you and welcome to Bharata First.
Namaskar. Namaskar. Thank you for inviting me, Frank. I'm very happy to join you on this discussion. And before we proceed, let me say congratulations. You just told me that you all have grown hugely in the last 2 months. The fastest growing organic platform on YouTube in 2021 with 60,000 followers in 2 months. I wish I had 1/10 of that in any of the social media on which I am. But congratulations to you and your team. You all must be doing a remarkable job.
Thank you so very much, Ms. Kumaramangalam. And coming from you, it really means a lot. And you know how high regard I hold you in. So thank you so very much. Let's talk about, this entire pandemic and everything that it has done over the last 1 year. And we've seen not just in India, but world over, women and children have borne the brunt of it. Why is it that every time there is something like this, it is the women and the children that suffer? Mainly the women and then next the children, of course.
First of all, Frank, let's be clear about one thing. Throughout the world, regardless of whether it's India or the United States or except perhaps in Iceland and a couple of countries in Northern Europe, women and children are in the bottom tiers of society. We are like a triangle. At the top are the influencers. Even there, mainly, there are many more men than women. And it has not seen a great change in the last 30, 40 years. Yes, women's rights have been fought for a very long time, and we have been able to now break the ceiling. Many of us have been able to break the glass ceiling, but many of us is a very small percentage even now. In number, perhaps, compared to what it was 20 years ago, you'd say, oh, you have a finance minister, you have this, you have that, you have many PA prime ministers, etc. Many who are doing better than the male prime ministers, but all of that sometimes I think is rhetoric. Basically, in more than 90% of homes around the world, and I'm talking about home because COVID has really kept us tied to our homes in the last 1 year, women are at the maximum of the second tier of the family. Now, violence against women is again endemic throughout the world, throughout history. Very little, there has been some amount of acknowledgement that violence is wrong, but for many reasons, violence continues. We all know that during the pandemic, because incomes fell, people lost their jobs, they were sitting at home, too much proximity to each other, too much, sudden change in their lifestyles, whether you're poor or rich or middle class, the brunt of it was borne by women. They not only faced violence, those who were working faced disruption in income, which means what little independence they may have had and what little bargaining power they may have had, again was abruptly lost. Many women went through unplanned pregnancies because of the lack of reproductive and family health services during the COVID epidemic. It's assumed that even India should have 2 million unplanned pregnancies or 2 million unplanned new births post-COVID last year's. Now, I don't know what it's going to be like in the coming few months. But pregnancy is not easy to go through at any time. When you're under stress, or if, God forbid, somebody has been infected with COVID in your family, again, then the burden of care is mainly on women. we do know that more than 80% of caregivers in health are women, whether it's doctors or nurses, more nurses. And most people, while we deify our doctors, we forget the stellar role and the absolutely, essential role that nurses play. I remember, Frank, when I was going to chemotherapy, my doctor would come and give the drugs and the dosage and go away. And through those 8.5, 9 hours of every day is this thing, it was the nurses who held my hand, who if I vomited, who if I wanted to, run to the loo, everything was looked after by them. And most of them are women. So these have been women have been battling COVID from on the front line without any complaint and without really any access to any sort of extra, whether it's care. I'm not talking just about money. I think it is more about spiritual, mental, and physical health and care that most women have lacked in the COVID during the COVID epidemic. Many will say that this is how it is normally, yes, but it's been more than exacerbated during the epidemic. Now, when the burden on care is more on women, because all working women who are sitting at home will also tell you that we are not able to, our lives are run on our maids. Now, our maids themselves, poor things, can't travel because public transport is disallowed, has been terminated, and they themselves are at great risk for getting the disease. So generally, women have had a very tough time. And another thing that very little is spoken about is disabled women. Disabled women have really had hell in the last 1 year or so. At the best of times, they are marginalized, they are stigmatized, they're not really part of society as such. I'm talking about both physical and mental disability. Mental disability in India is just not given its due. Maybe now some in some places we are talking about counseling and people saying there's some amount of relief available if you can reach out. But it's not really to do with women don't know how to reach out. When you're stuck at home with the person who's actually the main cause of your problems, be it husband, be it a grown-up child, be it whoever it may be, it's very difficult to access the net. It's easy for people to say go on the net and do it. But, an iPad or a computer or a phone, everything, the history is there. So there's a total lack of privacy where if you want to talk to somebody without being stigmatized, it's just not there.
Right.
Access itself has been a huge problem. For physically disabled, it's even much worse because, caregivers, there's a shortage of caregivers for those who are forced from within the family to care for them. They don't know perhaps how to do it always properly. The amount of money spent on their care is now being grudged because there is a shortage of money, let's be honest there. And the list is endless. Now, when it comes to children, what we are forgetting is that children below the age of 18 are overactive. How many of us, even you have young children, Frank, how many of us have seen that our children, poor things, they have nowhere to vent their energy? How much can they jump up and down, do dance class, do this class, do that class on the net? And learning on the net is not easy. Even teaching on the net is not easy. I have spoken to teachers of my granddaughter, and my own daughter tells me about. Teachers say that it's nowhere near as easy to teach a child as in school as over the net. Each child has different needs, and you can't meet every child's need on the net when you have a limited time. In school, the physical presence, it's a totally different ball game altogether. So children are also suffering. They can't go out to play with their friends. They are used to from morning to night. You ask a child, and by the time they're in third, fourth standard, they go to school at 7:30. They come home at 2 o'clock, some at 4 o'clock. Then they go out to play. Then they have their homework. They hardly have time for anything else. Maybe watch a little TV, play a little games. Now, what do they do whole day with themselves? And their children, they don't understand why. I mean, they know that they don't want to fall ill, but they don't know beyond that. So for them, mentally, I think a sort of fatigue has set in. The lack of
Absolutely.
physical exertion also tells on their health and on that of their caregivers. So we are, and again, they're disabled children. They're children, and today disability is not just about physical disability. There are so many other types of disability that we don't even know about, who,
Hmm.
when they don't have access to the places where they go to, which help them to recover or to learn to live with it, or to be more independent, etc. All of those are closed. So what are they to do? It's not just parents. There, I think it's not just mothers. I think many parents themselves also have been affected. But we are not able to really even gauge the amount of not just problems, the negativity that has hit many young children, especially I think below the age of 15. And okay, let's
Absolutely.
also look at this. About a month or and a half ago, I heard of this 18-year-old boy who just jumped off the roof. I was put on the phone to his mother by a very close friend of mine, and all she kept asking me was, both the father for little less. He had less to say, but the mother kept saying, "What did I do wrong? What did I do wrong? What did I do wrong?" Nobody knew that young boy was a bright, successful, popular young child. Nobody knew what happened. Suicide rates have rocketed amongst the young. We also note that over dependence on the net is causing a lot of problems. There are lots of predators on the net. And what are parents to do beyond a point? Those who do have access to the net, how much can we police? As we all know, our children are smarter with technology than we are. My
Right.
8-year-old granddaughter can, run circles around me. But that's also there. So the too many things that have impacted children that we are not able to even understand, many of us. I think now slowly stories are coming out. I think you would have heard that. I just read about this, and we spoke about it in another forum. Two 14-year-old children who started making videos on their form of sex, deep kissing or whatever it is. I haven't seen it. And they acquired a sudden huge following because they started making videos. First, they started chatting, etc. These are not children who have even ever physically met each other. So, what is happening? We don't know. And the impact of COVID, I think, more aside from the physical and the number of deaths, etc., which has caused so much trauma to women and children and everybody else, not just women and children. Let's be fair. Is unimaginable, and it's going to continue. Even when the real epidemic is over, the mental and the physical problems are going to continue. That
Absolutely.
is the most frightening thing.
I think that's a very valid point that you raised, and let's take that particular aspect forward. The issue of public health as a whole, it's going to
Yes,
be impacted tremendously as a result of this. Yes, we've seen the loss of lives,
yes.
we've seen the number of people suffering as a result of the pandemic, but the long-term suffrage, this long COVID that we are talking about, long COVID, I would like to put it in two ways. One,
Yeah,
contracting the disease and then recovering and taking long time to recover from it itself is one.
that itself.
But what
Yes.
but what about the mental health and the mental trauma that it has caused, and whether people will actually be able to recover from that? What needs to be done in such a situation?
Frank, if you want me to be 100% honest, I myself don't know, except that I know that people like me and you are lucky. We have, homes to fall back on. We have our health, some better than others. Still, we have it. We are able to reach out and talk to other people. But for those who don't have that sort of access, it's we need to create that. Now, I'd like to say one thing, that we have a habit of depending only on the government, whether it's the center or the state, for everything. Of course, I would like to also give credit to all those non-governmental actors, whether they are NGOs or people like you in the media, whether they are doctors, whether they are just ordinary people who come together to try and provide relief to people, whether it's those who are cooking food and giving, whether many things, who are counselors, who people who say, call me up if you want to talk, let me give you advice, or whatever it is. But there's still far too many, far too few. um, we are still in the mode of pointing fingers at each other. How does that help? We need to get out of this mindset. Yes, there have been mistakes made by everybody, by those who took it for granted that we don't need to wear a mask, by both state and center, when the central government, when they miscalculated or misjudged the intensity of what a second wave could be. There were many people who were warning us, both from the government and doctors, experts, etc. But most of us just didn't pay any attention. When we refuse to say that, accept responsibility, even personally, each one of us could influence at least another 50 people. Now, the tendency that a lot of people have today is if you are infected, you don't want to tell others about it because you feel you're going to be stigmatized, ostracized, etc. How does that help either? A huge behavior change is necessary in everybody in this country. By everybody, I mean the vast majority. We need to now, each of us, start asking ourselves, what can I do from this point forward to minimize the effect of COVID, whether it's on myself, whether it's on my friends, on my colleagues, on people who work at my home, etc., etc. And we need to learn what we can. There's a lot available on the net. There's a lot of people you could, I mean, on in the media, not just the net, both social media and other media. We need to start taking responsibility and taking charge also in some way ourselves. We need to stop saying, oh, this one said something, that one said something, he's at fault, I'm not at fault, she is the person responsible, I haven't done anything wrong. Because what you're doing then is that you're not taking responsibility yourself. And if we don't take responsibility ourselves to begin with, how do you expect us to come through this unscarred? And unscarred, I think, with very deep scars, which is not going to be very good for anybody in this country. We live in a society, we don't live anymore in isolation. And I mean, not only society, we live in a glorified huge village around the world. Everybody is interconnected. Whether it's relatives abroad, or whether we are traveling for work, or whether we get import things for our own consumption, everybody is interconnected. And the more we build barriers around ourselves and say them and us, the more it is going to harm us in the long run, because the word globalization cannot now become again localization. And even if we want to do it, it's going to take years to get there. So in the meantime, we have to learn to accept each other's faults, accept each other's mistakes, and also take responsibility both personally and as society, and as a government, etc. I find it very distressing. It's not necessary to keep apologizing or to say, no, only I'm wrong. I'm just saying that we need to do it collectively. Without that sense of collective, and it's, I feel especially disturbed because India is built on family values, regardless of all the differences between us, whether it's caste, creed, age, gender, etc. And that seems to be now being really impacted negatively in the epidemic.
Absolutely.
It's very difficult even to explain, beyond a point. I don't think
True.
there's much any data available, but this is really disturbing when we see it. There are many of my friends who have started their own little initiatives, but I can see how difficult it is. If you don't fit into the narrative today, immediately you're considered, you're shoved aside, literally, whether it's socially or economically or culturally or whatever other word you want to use. And that is very disturbing.
It
Whatever
is.
the narrative may be, whether it's at home, whether it's about politics, whether it's about health, it's about anything else. And we have stopped caring for each other. Now, I understand it when many of us are going through the most extreme trauma, and sudden thing it hits you. I lost my father in a plane crash. My sister's eldest son too died in an air crash. So I know how sudden grief can totally unbalance. You get totally unbalanced. Sometimes you just lose a sense of what else is happening around you. You're so overburdened by your grief. But for those who aren't, we need to understand that yes, we have to give much more than we want to or ever expected to. And unless each one of us pitches in, it's going to be very difficult to come out of the impact on women, children, all of us as individuals, as society, as families. And that also, I think, is one of the untold impacts on women and children. Women and children are used to being supported and protected by a family. Now, when you
Absolutely.
suddenly lose a loved one or a friend or a colleague, it really, it shakes you.
True.
And who do we, women and children, actually, how many of us can actually go out and talk about it? Women are not taught to actually talk about their emotions. There are very few women like me who will call a spade a shovel and, say, I don't care what happens. I always say, for everything that I may have gone through in life, I'm extraordinarily lucky because I was never taught to doubt myself. I mean, all right, you make a mistake, that's different, but never beyond a point. And I can talk about what I've been through. Most women and children, of course, can't. I mean, they talk to their mothers, to their families, yes. Outside, it's a different world. In India, the way our children are brought up. So where do they go? And they're afraid of being, found fault with. We have
Since
children who are so sensitive nowadays that if they don't do well in the exams, they try to commit suicide. Think about what they're going through now.
Absolutely. And since we are here, Ms. Kumaramangalam, let's talk about this aspect as well. Do you think that we need to have, a better system in place? One is grievance redressal, so that people can actually go out and their issues can be heard.
Yes.
Should we also build or create an environment and an atmosphere where people can freely talk about the, issues that they are facing in life? Do we need to have better counseling centers, maybe set up by NGOs, by the government or anyone, so that we just have these in place? Because in the West we've seen people are used to going to shrinks, but here it's still not a
Yes.
concept. So do we need this in place?
It's not only not a concept, it's very stigmatized. If
Hmm.
you say I'm going to a shrink, that's it. Tum to pagal ho. I mean, there is no in between. You're mad. And it's very stigmatized. If you tell somebody that, I am having strange thoughts, I'm not able to sleep, I find I'm having horrible dreams, they immediately say, no, 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 you should do deep breathing, which is fine. Doing yoga, pranayama, and all of that is okay. But there are certain things that you need to get out of your system. And when it comes to mental fatigue, mental problems, there is no degree in this country. You're either totally mad or you have to be totally sane. So the concept of counseling itself is very alien to India. We are very, very judgmental about it. I remember the head of one of the very big departments in SRMC College, Sri Ramchandra Medical College in Chennai, telling me that, ma'am, in a country of at that time it was 1.3233 billion. He said we need at least every year we should have at least and he said, look, if you ask me, within the next 5 years, we need to produce 5 lakh psychiatrists. People who are trained with the basic knowledge of psychiatry. It's not just enough counseling. You need to know what you're talking about, or you need to have a 2-year training for counselors, grief, death, everything, whatever it is. Counselors who are available at schools, at colleges, at offices. He said everywhere you need to have counselors, because today's life is so fast-paced and so it changes so quickly. Most of us are not able to keep up. He said, as a doctor, I myself find sometimes it's not just physical fatigue. Physical fatigue you can get over. Mental fatigue is far more difficult to get over. And that's what we don't understand. But where do we have the psychiatrists and the psychologists? If you look at the number of seats in medical colleges, these are often the least desired seats. Because people think they can't make money out of it, or that, they will be again judged unfairly. It's not amongst the top, not like heart surgeons and, the cancer doctors, etc., etc. Um, we need, everybody has to, again, like I said, everybody here, the government has to now consciously set up centers where we can train. By government, I don't mean just a center. I mean all elected representatives at the state level, at the panchayat level if necessary, every level. We need to have, consciously, we need to bring public health into the mainstream. Along with things like building roads, building irrigation, water, etc., health has to now be brought into the mainstream. We need a huge mindset change there. Because economics, if you take the economics, the cost of mental health around the world, it's some mind-boggling billions. The last I read, which was about 2-3 months ago, I'm saying aside from COVID, if you take COVID into it now, it goes into hundreds of billions if you take the cost economically worldwide. But COVID also takes into account the fact that there were lockdowns, etc., etc. Even without that, mental health costs an economy like India, roughly, say just India, it costs us about 2 billion every year. Whether it's in terms of leave, whether in terms of suicide, whether in terms of grief counseling, or so many other problems that people face. And we have not yet taken that on board. So I would say one of the biggest changes we need, Frank, first of all, is to bring health, public health and personal health into the mainstream of development activities. We can't anymore say that it's only education and environment and building roads and roti kapda makan. It has to include public health. We are far too interlinked as a society, as a community, as countries. Unless public health is addressed on an emergency basis from now onwards, and it'll take time. It's not going to get done in 6 months or a year or even 2, 3 years. Maybe it'll take 5, 10 years. But we need to start sowing the seeds right now, so that at least going forward in the future, we are better prepared to face such epidemics. And everybody keeps telling us that this is just one after another. We had SARS, we had HIV/AIDS, we had so many other things, Ebola, etc. It's just unlucky that COVID spreads through the air. It's the fastest spread. The rest were the mediums were different. But we don't know where we're going forward with this. But COVID itself seems to be, mutating so fast. So they're talking about a fourth surge in certain countries, and India is still at the second surge. We don't know data from countries like China and many other countries in Africa, etc. So I think we need to now really accept that public health, part of which should also be mental health, has to be given its importance, and public health has to be now mainstreamed in all developmental activities.
The scary thing is, when you say that there's no doubt that we have to focus on public health, and that should be our biggest focus area right now, because we spend about 1.4% of our GDP on
We
healthcare.
need roughly, at least to begin with, straight away 3.5 to 4%.
Exactly. A country like Bhutan spends about 2.5% of its GDP on healthcare. So it's abysmal when we talk about 1.4, and this after we increase the allotment in this particular budget to 3 lakh crore rupees.
Yes.
And you're also saying
Historically,
it's
we've
going to
spent.
take so much time to
It
actually
will.
get to where we want to.
Change takes a very long time. Change takes a very, very long time. The demand also has to be there. There is no demand for public health in our country. In a crisis, then yes. Otherwise, where do we think of, say, at the panchayat level, even some of our best panchayat presidents, who are, as you know, there are many of them educated, both young women and men, who have made a tremendous difference in the lives of the people in their panchayats. Even they have not given as much attention to health as should have been given. Look at how long it took us to eradicate polio and smallpox, right? And that was really a joint effort. Even now we have TB. Even now we have leprosy. Much less than in the past, yes. But there are, and one of the other things that I really think is going to impact health is the lack of sanitation in India. As we
Absolutely.
build mega cities, mega towns, mega whatever, where is the sanitation? And that's it's impacting both our environment, which also obviously is having a negative impact on our health, as well as our whether you want to call it standard or the impact on even life cycles. A very good friend of mine who is a senior doctor told me recently that, I said, why is everybody dying of lung problems? He said, for God's sake, you live in Delhi NCR area. Don't you know that our lungs are nobody perfect anyway? It's compromised because of the amount of pollution we live with. Our lungs are vulnerable to begin with. So you have a clever virus. That's the nature of the virus. It catches you at your most vulnerable. I said, how you put it so simply? He said, it is simple. You don't need very complicated jargon to be able to understand that. But we don't think of health. That's what he said. He said, we ourselves don't pay attention to our health. How
Absolutely.
much? He asked me, he said, are you doing breathing exercises? So I said, no, I do yoga. He said, yeah, but you are somebody who will know about proning, this and that. Are you doing anything like it? I maintained a very guilty silence. At that point of time, I realized that so much of it is on our own hands too. Even those of us who can, we don't.
True. True. And before I let you go, Ms. Kumaramangalam, let's also talk about what's the best way forward, what we need to do in the immediate near future as far as the women and children are concerned. Let's come back to that also now. In the immediate near future, how do we safeguard and protect them? What needs to be done in the long term?
In the long term, as I told you, our planners need to take public health on board in a major way. Public health needs to also look at the specific problems of women and children. Public health must also be networked with other redressal systems, like you said, whether it's redressal for violence, whether it's redressal in case you lose a partner and you don't know. Most women don't know when their husband suddenly die, where the property is going, if they have any property, where the savings are. Nobody knows, and you're so full of grief. Women are not trained to do that. We need to start now specifically doing publicity or information, education, communication, as we say. Campaigns to tell women and to tell even others that organize yourselves. You need to know, where everything is, especially your affairs aside from just food and clothes, etc. Your financial affairs, your economic affairs, everything else. That's one. The second thing is, of course, that significant investment in public health by governments, by institutions also, and in terms of insurance, for example. I'm told that insurance companies, many people are having hell, even though COVID has been by the government compulsory, they are told they have to give the money for it. And mental health, when it comes to, of course, I mean, every insurance company will say what's the need for them to be hospitalized. Sometimes you do need to hospitalize even for mental health if somebody gets violent. There are many, situations. So health needs to be mainstreamed, like I said, not just in development, but redressal and health care has also got to be now given a primary importance. We need to start talking about health even to our little children. We need to start talking about things like hygiene and sanitation, which is a very important part of health, right from childhood. You have to teach children washing hands. COVID, this whole thing about washing hands. How often do we teach our children wash your hands? Hardly ever. Maybe in some homes we do, but even that it's now and then. We don't make it into a routine that wash your hands before lunch, wash your hands. I mean, some of us are taught that, yes, but most of us don't really. These small things, we need to now make them into big issues also, both personally and collectively. Also, we need to understand that you can't talk about the economy without talking about health. You can't talk about health without talking about the economy. Um, we need to understand that all sections of society have been equally impacted by this. The poor more so because for them their source of income is not permanent. So for them, many may say I'm sounding very leftist. I don't mean to, but we need to at least now in our plans as we move forward look at the social security aspect of the poorest in this country, of labor, migrant labor, for example, of the disabled, uh, in, disabled in every sense, be it mental, be it physical. We need to look at systems like the education system where priority is not just given to the STEM subjects, maths and physics and chemistry, but also the environment, also, as I say, health and sanitation. But what's the point of having money and this and that if you don't have health? I think only now people will understand what I'm trying to say. So we need to make it very clear that our priorities in some ways must shift. We don't need to change it totally, but at the very least shift to include whatever we have learned from this terrible pandemic. We also
Absolutely.
need to, there is an increasing need in the world for domination, whether it's individuals, whether it's, individual billionaires or those who can do it, or countries. I think the world itself needs to, and it's not just India, we are, of course, more interested in India, but we need to stop politicizing everything.
True.
Politics has become too much a part of even everyday ordinary life. It is creating too many fissures. Too many of us genuinely believe that it's either my way or go, I mean, get lost sort of thing, or the highway, as they say. Uh, we need to start talking about how we can come together to fight such problems. COVID is, from what I know, it's nowhere near gone. We'll go through the second surge, India will survive, all of that I agree. But there is a third surge which people are already talking about, and they're saying it could hit our children because they may be the ones, uh, as somebody again explained very simply, the virus is going to look for the most vulnerable. And if adults, many of them have been vaccinated, then the children have been so far left out of the ambit. We are being told that, yes, the nasal thing is going in for third stage trials, etc., Bharat Biotechs. But it will take a little time. We are also being warned by several very well-known doctors and experts that parents of caregivers of children need to be vaccinated quickly. Going forward in the immediate future, I think we need to take account of and plan for 6 months ahead. We shouldn't just say that we have somehow managed to get through, so now heave a sigh of relief and sit back. We can't afford to sit back. We have to look at what the third surge may bring and start preparing for it right now. We've found, oxygen, as you know, and remdesivir, the medicines that were needed are in such shortage that so many people have lost their lives. Now, in the third surge, at least for the third surge, all of us put together, whether we put pressure on the government, whether we talk to our local MPs, MLAs, panchayat leaders, whatever it is, each one of us should now put pressure on those who can make this difference. And in the short run, that is what we need to look at. In the long run, like I said, for me at the moment, I'm not saying don't build your highways and all of that. You need it because we need transport also, quick transport. But we need to really bring health into the mainstream, spend more on it, pay more attention to it, plan better for it, coordinate with all other departments in the government if necessary, whether it's finance or whatever else. All the big employers, for example, construction is one of the biggest employers of migrant labor or mobile labor in our country. Sit and work with them, talk to all the big construction companies and say, what can you do to prevent this the next time? All of this. So there needs to be a huge amount of coordination between departments, between ministries, whatever you want to call them, in the future. And that should be long term. We should now make that part of
Absolutely.
the system. In the short term, immediately increase budgets, come down very strong on insurance companies if they are not helping people in need, because I know it's a business, but the business is only there, people are there to avail of that business, right? We need to start looking at what could crop up in the third surge, a likely third surge, and be very well prepared for it. We need to start working together, put our differences aside and work together.
Absolutely. I think very well put. And if we do that, I think we can go a long way in trying to address the problem at hand. If we work together, that's the only way that we can defeat this particular pandemic. Ms. Kumaramangalam, thank you so much for joining me on the program, sharing your views
Thank you,
and putting
Frank,
things
for
into perspective
inviting
for
me.
us.
Thank you for giving me this chance. Thank you very much.
And before I go, once again, let me thank you for your continued support. For those of you who haven't already subscribed, please like the video, subscribe, hit the bell icon, and then all notifications. Do follow our social media handles for all the latest updates, and you can also subscribe to our newsletter to get some incisive content. The Bharata First team runs a daily big picture quiz. Please do participate by going through the description in the big picture videos. Here are the UPI IDs for those of you who would like to come forward and contribute. A small contribution you make will be a giant leap for us to keep bringing you this content. So do continue to show your love and support. All this information is in the description of the video, so kindly go through it. That's it from me. See you again next time.